Hello, my name is Dr. Dyer from Englander Chiropractic Center. I am joined today by my beautiful, beautiful, wonderful partner in crime, Art, from Waltham Therapeutic Massage and Fitness. How's it going, buddy?
Really well. Thanks for having me, Don.
Absolutely. Today, we are going to talk about tech neck, which come to find out when I originally sent out the message, I thought to my own discredit, I suppose, that tech neck was more of a ubiquitous term that everybody actually knew the definition of on some level. But I actually came to find out that it's not as well known of a term as I thought it was, which is one of those you don't know what you don't know kind of
Yeah.
situations. So I think that this really gives you guys a lot of good value because we can kind of discuss what Technic is. A lot of people are probably at least vaguely aware of what it is we're about to talk about. They might just know it as a different term. So I think that this might actually be really, really helpful for you guys. And I have brought Art on with me today in order to discuss a more multifaceted approach, which I think is very, very helpful in healthcare, especially with something that is, I guess, another way to put it, is also another multifaceted problem because TechNet can be kind of complicated in regards to how to fix it. So this message is being recorded. We, of course, love to offer something at the end of these things. So if you are watching this afterwards, come to the next one, which happens most of the time the third Thursday of every month. And if you do that, you will also get access to whatever little thing we got going on after this. But let's go ahead and get started. So, what are we going to do? You've come here today. Let's talk about what we're about to talk about. So, we're going to introduce ourselves. Like I said, I'm Dr. Dyer, and this is Arthur. We're going to talk about what TechNec is. We're going to discuss how personal trainers, which is what Art is, would approach or see TechNec. Then we'll go over how a chiropractor would see TechNec. Then we're going to talk a little bit about the importance of care plans because this is a perfect I don't know what, like I guess you call it like a syndrome in some ways because it has a lot of different things going on. It's really important to think about how care plans interact with something like this because it's a little more complicated than just, hey, I have a little bit of pain. And then we'll kind of go over some of the things that we talked about. So, what is tech neck? As a very, very simple way of looking at it, tech neck is a chronic, which just means long term, usually about 3 months long at least, neck and upper back pain caused by poor posture while using technology more often than not. People consider it slouching. So whenever you see somebody slouching forward, they specifically are usually doing it with Technic to look at computers or phones. There's lots of little devices that we could probably go into, but you don't see too many people pulling out pagers and little PDAs anymore. That was probably before I was a professional. So I think I missed that era, unfortunately. Maybe next time. Maybe I'll get one for nostalgia's sake. And then develops from using things like tiny screens that are and while we're also being seated, the new age of American business is mostly people just sitting in chairs where they then drive home or they're already home where they sit in a car to go home to sit at a couch or a table so they can eat dinner before they go sit and watch TV before they go lay down. So humans were designed to constantly be moving, and the forced sitting posture is the next step in what you consider our evolution, which is not a good thing. This is one of the situations where I think tech is causing us to de-evolve, I guess, in some ways, unfortunately. I should have included that little it's like a joke that you see on the internet where it's like the human progressing from like the ape where it goes up and then it like starts to go the opposite direction where they're hunched over a computer screen. That would have been a
Yep.
clever thing to include here.
Yep.
But yeah, that's kind of what's going on. So what is tech neck? So tech neck is the forward translation of the neck that puts too much pressure on the root of the neck. Shoulders will start to roll forward, which causes the muscles that control the shoulder blades to become tense because they're trying to hold your shoulder blades still so that it doesn't pop off, which would be very bad. And it's a constant tight pectoralis, which will bring the body forward and place more stress on the neck. If you really had to visualize what it is on a daily basis, it's you're sitting at the computer, shoulders come forward while you're ticking tacking on your keyboard, head comes forward because you're looking at the screen. A lot of times with people that should be wearing glasses, they do it in order to be able to like see whatever it is that they're looking at. And while this is all happening, it's compressing the chest. Lungs are getting scrunched so that you're not getting as much oxygen as you probably should be, which can lead to things like fatigue, stuff like that. And this constant hunched over position is going to cause your shoulder blades to roll forward. And when that happens, the muscles that go from the what we call the medial edge of the shoulder blade, which is the part that is in the middle, to constantly be tense while going to the spine because it's trying to hold it still so that your arm just doesn't like pop off your body, which again would be it'd be a bloody mess. We wouldn't want that. That's a big no-no. And all this position will cause the muscles in your neck to get a little freaked out, which will very, very consistently lead to headaches, which again, the common symptoms of a tech neck is upper back pain, neck pain, tight chest, headaches, pain along the inside of the shoulder blades. I pretty much just went over all that. You're going to mostly feel this while you're sitting, but it's definitely going to be at its worst while you're sitting at a desk while at work. The other one that I probably should have put in here that I just occurred to me is you'll probably also really notice it while you're at home, sitting on a couch while what we call doom scrolling on your phone. So you're going to be sitting there being like, wow, I wonder what's going on with the Kardashians, and then you're going to be doing this. And so this is the perfect disaster position for what we call tech neck. And, obviously it's a really, really bad thing that's been getting worse as we go because tech is becoming much more ubiquitous with our lives. I'm sure anybody that's been any older than me grew up in an age where there just wasn't tech and this wasn't much of a problem. You don't see it nearly as much back then as you do now. And I can truly say, and I bet Art would back me up on this. I'll ask him, but like even today, I can be driving my car and watching people walk on the sidewalk where they can't escape that hunched over position,
Yeah.
even though they're out and about walking around. Would you agree with that, Art?
Yeah, 100%. And a lot of it is psychological at this point. They're just trained to be like that. It's not even necessarily about tight muscles and such. Yeah, but I'm
Right.
with you. I'm with you.
And it's a really bad combination of things that affect people's lives, which really stinks because people want to be able to do whatever they want whenever they want, which is fine. Obviously, there's some physical limitations for some people who might just have backs that are shaped slightly different, which is fine. But unfortunately, it's becoming more and more common, and it's a good idea to at least know what's happening so you can avoid it, and you will avoid all kinds of just terrible things in the future. But let's at least start talking about that. So, Art, take it away, sir. Who are you?
Arthur Capozzi, nice to meet you guys. I'm the owner and founder of Waltham Therapeutic Massage and Fitness. And if you look over here on my little tagline on the bottom, it says relieving stress for people who work at a desk. And I came up with that because I worked in the sales, the B2B sales, big company sales for technology companies locally in the Eastern Massachusetts area, let's say for 22 years. And really a little bit longer than that if you include other companies. So, I have like a 25-year corporate career. And to make a long story short, I started to injure myself as an occasional weightlifter, and being into fitness in general, and started to look at massage therapy and personal training to help me make sure that I'm on track after getting a couple of mild injuries. And I started to realize this is while I was still in the corporate space. Started to realize that I liked it and I had an affinity for those sorts of things. So, after years of sitting at that desk in that executive role, I spent a lot of time trying to figure out why my neck hurt so much and why my posture wasn't what I wanted it to be. And as I started to think about where I wanted my career to go, I decided I wanted to have more of a client-based career. So began to think about disengaging from corporate life and started to go into massage school. I started to get a bunch of different certifications that you need to, do other things. And I came up with the idea, not that it's all my idea, but, the way I, deal with it is kind of unique. But I decided to combine personal training, assisted stretch, and hands-on work, or massage work, therapeutic massage work, often targeted stuff, and just put it all together, working backwards from the problem of being a corporate person who sits at a desk all day under stress. Because I think the additional, experience that I had in that position, not just in the chair, but also dealing with the stresses that come with constantly being asked for a forecast and, a lot of time contending with acquisitions, you're at a company 18 months and then it explodes and goes away because of an acquisition that happens. It creates a lot of psychosomatic stresses. And to talk a little bit about, Dylan's little illustration of the problem when he was hunched forward, that's really the issue. When you take your hands and put them on the keyboard and the mouse, that's where ergonomics pretty much go out the window and drive that head forward. But with the stress part of it, you take you're in a flight or flight mode a lot of the time, so your shoulders come up, and that puts an additional stress layer. It's trying to support the head, but it's coming up because of the stress levels that you're under, just doing the day-to-day stuff. So that I noticed was driving headaches for me. And so I started to kind of reverse engineer this stuff. So I became like I said, a personal trainer. I'm a licensed massage therapist with a bunch of other certs. And my business, Waltham Therapeutic Massage and Fitness, is right in Waltham, as you can probably guess. So that's the short story on me, Dylan, if that makes sense.
That makes perfect sense to me. And obviously, when you find somebody in the healthcare world, you want to find the people who are, like they have like some kind of stake in the game, right? Like most healthcare people come into this life, I don't want to say lifestyle, but this like line of work because it is, we have most of the time, not always, some kind of interaction with the things that we're trying to fix that we also had to deal with. A lot of chiros are people that got injured in sports.
Yeah.
They get introduced to chiropractic. In his
Mhm.
case, Art is very, very well versed in the business world just because he was involved with the business world, as he was saying. So 100%, I agree. I think Art is very, very well versed in this uh, line of, this train of thought, at least
Yeah.
for fixing
Space.
this kind of
Yeah.
situation.
Yeah. Right. Yeah. Fair enough. Fair enough. I
And
was also,
when I met him, I knew we had to talk about this.
yeah, yeah. And I reached out to Dylan because of, my feeling that these are complementary. I don't know. Again, we're struggling for the word. Is it discipline, lines of
Yeah.
thought, trails, paths, but they're very complementary.
Yeah.
I've got people coming to me, and every once in a while, I'm like, I want to get another set of eyes on this issue, and so I started reaching out to chiropractors, and Dylan got back to me. We've had a lot of good conversations and meetings since, and that's what led to this session today.
Couldn't agree more. All right, sir, are you ready?
Yeah, sure.
How do you see Technic as a personal trainer, Art?
Well, I'll tell you what, people can read the stuff on the left, and I'll talk about it real quick. But the more important thing is just to go back to the picture you already presented from the perspective of a hands-on massage therapist plus a personal trainer. What do I want to do with that picture right there? I think that's the way I would probably respond to the question about Technic. It's just, what do I want to do to fix the problem? And so what do we have right there? You got a weak portion and a tight portion, right? So what I want to do, and this is a little different than the way, someone in Dylan's position is going to deal with it, but what I want to do is strengthen the weak muscles, and I want to stretch and loosen the tight muscles. Pretty much that simple. The result of that's going to get what you start to see here, which is, I'd say that's a good posture right there, right? That's a head stacked over your hips, which is what you're looking for. Fair enough, Dylan?
Yeah, this is like a perfect what you want to see on every person that comes in. It's not common,
Yeah.
but yeah, it's definitely what you would like to see.
Yeah, and within that context, I'll just run through those 5 things on the left. So the myofascial trigger point thing and the headache, we already touched on why the headaches hit, but that's the part where, the reason that people go to massage therapists, generally speaking, is to take care of this upper trap shoulder area and the base of the neck. That's, you see it everywhere. So that's why there's an industry there. The TMJ disorder is really interesting. If you get this stuff from the right angle, from Dylan's perspective and from mine, you can really make a big jump on dealing with, jaw pain, let's just call it. They're saying TMJ. Let's just call it jaw pain and tightness. You can make big progress there when you're within the context of relieving Technic, generally speaking. And then you got the pain in the back and the rounded shoulders. We touched on that. And then the respiratory inefficiency. If your posture's not good and you're slumped in front on top of your lungs, putting weight on them, you're not breathing properly. You're not breathing efficiently, as it says there. There's a lot of that going on when you're sitting at that desk for 8 hours. Now think about what that could mean. I'll pause there and just see if Dylan wants to make a comment about that. But that would be how I look at Technic. Basically, it's just a forward head lean driven by sitting in front of a computer all day long, and it's really hard to avoid because you just can't ergonomically avoid looking forward. It's that simple.
I would say that he was exactly spot on. The one additional thing I'd like to always think about in these situations, especially when it comes to the TMJ, lots of people come in to my office, at least with some upper neck pain, that a lot of times if I were to just push on it, it would probably not feel so hot. But there is a line of fascia that goes to the jaw into the top neck, which I think from a tech neck perspective, this is one of those chicken or the egg situations where it's very possible that I think sometimes someone's jaw might be having problems from from the reverse aspect of it, where the neck itself could be pulling on the jaw itself, which could be causing some clenching. And then you also, like Art was saying, the emotional aspect of clenching your jaw because you got a deadline or whatever,
Yeah.
working in the corporate world. So I think that the temporomandibular joint, the TMJ thing, very often overlooked. I love to treat that stuff. Usually when somebody comes in, I'm always messing with their jaws just because neck and jaw are one and the same in a lot of ways. How often do you find that to be the case on your end?
Like just out of 10 people, do I see with the issue? Probably four, three or
Okay,
four.
pretty
Yeah.
common.
But like you said, it's hard to know. Is it the posture causing it, or is it coming from the other end, right?
Right.
Because they definitely connect, and that's what makes this so interesting. Why I like all posture conversations, but technique in particular, just so interesting because you just don't know it's a mystery. You got to start by talking to the person, you know.
And that's where a good evaluation from a good personal trainer, a good chiro, good MD, a good physical therapist, anybody,
Yep.
if you get a good one who's actually paying attention to those, a lot of those really weird little things that you think might not even be related, where you're just like, yeah, I was, doing the dishes, and for some reason I
Yeah.
feel like my jaw's, I don't know why. I'm not even in the office, or I was sitting at home watching TV and I had this thing. Well, it's like a good physician will be able to explain that to you in a way that you can understand while also hopefully providing some kind of way to deal with it. But unfortunately, when it comes to the tech neck, it's very much a lifestyle type problem,
Yep.
which I think doesn't go away as quick as people want because there's a lot of work outside of the office that also has to happen.
Yep.
But I have found that somebody like Art is very, very helpful in that regard because he not only will he help you with the problem directly, but he'll also give you the tools in order to take care of it on your own in a lot of ways. Where a chiro like me, I can kind of give you the quick nitty gritty, be like, yeah, you should probably work out. You should probably do these exercises. I'll give you a quick example, but I can't sit there and do an entire like workout regime with you, which is exactly what the benefit of somebody like Art is, which I think is wonderful that he's around. So I was really happy, like I was saying earlier, to have him around to teach you these things, which we're about to get into, hopefully, if you are ready to start talking about that, sir.
Yeah, sure. And not to reiterate again, but reiterate again, deja vu all over again. It goes both ways. I can tell you there are times when I say to myself, I see someone two or three times, I get a certain amount of progress for sure, but then I'm like, I just want to get them the whole 9 steps that they need to get down. And
Yeah.
having somebody like you available on a short leash is really good for me to. My goal is to solve the problem. It doesn't matter to me who solves it.
Sometimes you just need a good crunch.
Yeah,
Sometimes you just need a
yeah.
good
And as
crunch.
a team, it can be a team sport.
Absolutely. So go ahead and run through what you might evaluate with somebody.
Yeah, that's great. So if you look at that little diagram on the left, basically there's 5 places that I look if someone comes in, complaining about this wheelhouse. It starts with the feet, goes to the knees, goes to the hips, goes to the shoulders, and goes to the head. And you got a guy there, that lateral guy. He's got a really nice posture for sure. And a couple of my clients are on the right, both of whom have had neck pain and or concerns about posture that brought them to me. But they weren't, they weren't like in the wheelhouse where maybe I should go see a chiropractor first. They were just like, hey, I want to work out. And since I have this focus, it all just sort of started here. Some people like this could have very well gone to Dylan, and then I find out about it from him, and now maybe he'll meet one of them from me. If I discover something that needs an extra look. But if you look at these two clients, they have a nice posture right now. The one on the right there is very confident in that posture, and we've done a lot of work together there. And then same thing on the left. The head is stacked over the hips, so that's the key here. It's the key to posture that I coach when people come through for that first assessment is if you have control over the hips, you can start to have control over tech neck. If your butt's sticking out, the head's going to go forward no matter what you do. So I like to start people with basic posture tech, like a basic posture assessment, and drill it into their heads where the head belongs. over the hips. And once they start to get that, there's a lot of aha moments, and then it becomes more logical, and there's a flow with respect to the rest of the work that I do and the work that they're going to do when they're doing their own homework. That I'll answer it that way. In this case, you're looking at two people who've both come out of deadlifts, kettlebell deadlifts. And deadlifts is one exercise that I like to get people doing to get this connection made, because it works basically the whole back half of the body. And the weight there gives people, when they begin to understand how important the hips are in this, when I start putting the weight in their hands and the shoulders start to come down and the core is strong, the shoulders are basically in the right spot almost completely. It doesn't require a lot of extra coaching, and they begin to feel what that load is supposed to be like, and it reports back to what the posture is supposed to be like. There's just a connection that's made. And I'll pause there, Dylan, but that's how I describe it from here.
And so a couple things, one question and one comment is, when somebody comes in for me to evaluate, the first thing that I always like to look for if I'm suspecting a technique is you start to see it right here. This is that dreaded, well, that's not a very big example of it, but you can kind of see the beginnings of it, what they call like the old lady hump. They call it a dowager's hump. This is something that usually results in somebody who works in a corporate environment, because your body's trying to protect your neck, which I'll go into a little bit later. And then the second question I wanted to ask was, even while I was watching, I did watch him do one session with a patient, which I thought was absolutely fascinating. Something that I absolutely love the idea of was this 45-degree thing going on with the foot thing. Can you explain why that's important?
Yeah, so that's a 45-degree plate. I usually start with 15 degrees, so it's not so high. So it's a deadlift variation that we're doing here. And it's because there's a postural imbalance associated with being forward, everything being forward. And also sometimes the big toe is not in the right spot. You know, people walk with their feet pointing out. You know, this platform disciplines people to get the toes and the feet straight. So there's a relationship with the hip there, not to get technical, but at the end of the day, the lower back is weak and you're forward a lot. And this helps to compensate for that weakness while they're getting started. So it activates the bigger part of the back of the leg, the hamstring. And then from there, all you got to do is retract the head, compress and relax the shoulders down, and you're working the back of the body. And when you're doing a proper deadlift, and even squats, you're really supposed to, most of the time, have the weight distributed on the heel. So this is just helping people get started. I go 15 degrees to start, 45 degrees, and then we start getting on the floor, and then we start getting on less stable environments, which you'll see an example of that. But that's basically the short story to answer your question.
And one thing I notice is when people start to improve on their posture, you'll notice that up here gets a lot better, but then they'll start to like push their hips forward because they're trying to like make up for a lack of movement, which I think that's a super clever way to handle that. So I've got to say.
And I'm constant. I mean, all I ever do, Dylan, with my clients is say, all right, strong glute, give me strong glute, flatten those hips, flatten because I can always get another degree out of them. And it starts to get it in here. And then suddenly that head's now not sticking forward.
Right.
Yeah.
Couldn't agree more, which will come up with the care plan thing, which is, I think you slightly touched on.
Yeah, fair enough. And then I just wanted to give people one more shot. This is the same client. Now, again, you know, and well, actually, if you look, we're on the left. If you look on the left, we've progressed in this one to an unstable environment. So that's a soft foam piece, just to start getting the conversation about balance going. You know, if you're very, very tight in the upper traps and the lower neck all the time, there's a connection between balance and stabilization. So that's another thing that we like to do, is progress through less stable environments to address that. But in this case, it's the same thing. You've got a client who's doing a deadlift, activating the back half of the body real strong. Those are 30 or 35-pound kettlebells on the right. On the left, it's a little lighter. And if you look at her standing here, like Dylan said, there's a little bit of a forward lean still implied, right? And we're just working through it. But she's got solid posture here, and that right foot is kicked off. It's not straight, but again, that's the other thing I'm kind of always on people about, for reasons that we can talk about on another show, I guess. But yeah, so again, just a progression. The right side, I guess you could say, is the beginning point, and the left side is actually the end point of a successful deadlift here.
And again, like I was just alluding to, you could kind of see as she's starting to straighten, she's like pushing her pelvis forward a little bit because she's just trying to get the mobility. So that's something we're always looking to improve. I think obviously she's definitely probably doing better than when she first came in, 100%.
Yeah, without a doubt, both of them were for sure. And if you go back up real quick go back up one slide. If you look at that's the same person on the right here, my right. You can see she's got a lot of confidence holding a lot of weight there. And the hips are looking good. You know what I mean? Those are strong legs, strong hips, and those shoulders are where I want to see them given the situation. So yeah, I mean, they're both progressing real nicely. Yeah.
Yep. And she looks good. It's like, like
Strong.
yeah, it's like the way to look at it is like you can tell somebody who's got a more proper posture, they just look better, they look more confident, they look healthier. It's just something that is like a side benefit of getting something like this fixed.
Sometimes I point people to NFL players. If you ever see like an NFL defensive back makes the tackle, gets up, pops up. You ever notice, Dylan, how flat their hips are when they
Yeah,
walk?
they
They
really
got
are.
beautiful strides,
Hmm.
And why? Because they're not sitting at a computer all day long. You know what I mean? They're out, they're lifting weights, they got proper training, and they're young, and they're out there in the world hitting people and tackling people. You know
And
what I mean?
even in their situation, they're in a professional environment where they are constantly hunched over because they're constantly on the line, right? So it goes to show you that you can escape that position in a lot of ways.
Yeah,
And you can also like if they can do it, you definitely can do it. It's
yeah.
not it's not something that's insurmountable.
And a lot of, a big part of the reason they're there though is because they're putting a load on. They're putting some weight in, they're putting a
Yep,
weight against their body,
yep, yep.
which, and again, powerful hips, strong glutes, strong lower core. Next thing you know, you really got that posture coming along. And again, that starts to speak to the tech neck issue. Really, if you're not dealing with the whole posture, you're not really dealing with the neck so much
Right.
down the line. But to get into some more little exercises here, this is a chin tuck on the. If you go to, my pointer may not be working. You see that? Can you point out the chin tuck, Dylan?
There's the
The
chin
one
tuck.
on the bottom. That's it. That's a chin tuck. So
Oh, chin.
we're just
Okay.
strengthening the neck with that exercise, dealing with the neck. And I'm sure Dylan suggests that one, that type of thing to strengthen the neck flexors. And then on the middle one, the same person from before, she's up against the wall, compressing those shoulder blades and stretching out the back and getting the arms and shoulders rotated back, and then getting the head flexed back with the neck flexion too. So that's loosening up the entire structure, right? And she's doing that on her own with a little coaching from me against the wall there. You got hyperextension, a back hyperextension on that ball, and then ITY, which I really love because you can really work those rhomboids and the little muscles way up at the top of the back to get the strength where you need it to be able to get that heavy head back over the hips where it belongs. So, and that's the kind of stuff I'm just exhibiting here. This isn't like a full end-to-end care plan because we have a limited amount of time, and I think we got to deal with this in bites. It's more of a broad conversation for today. But yeah, that's the type of stuff I wanted to just point out today.
And from a chiropractic standpoint, the one thing I like to really illustrate that really supports what's happening here is as humans, based on evolution or however we were made, we are very well designed to go forward. All of the most powerful muscles in the human body want us to go forward. That's because we are a forward facing species. Our eyes go forward. We're technically considered predators in that we are designed to go forward as fast as humanly possible to do a thing. And we don't really worry about the back behind us because that's actually where the least amount of nerves are in the human body. Our neck, our back is less sensitive to like brunt damage and all that because we are designed to go forward. And all of the exercises illustrated here are having somebody go the opposite direction. These are all back focused exercises. So, like, even with this cable pull, she's pulling up, which forces her upper back and her lower back to work together. And when you do that, if you activate all the muscles in the back, it helps balance that overpowering front muscle thing that humans have going on, which is why it's very, very important to make sure you don't forget about your back muscles and you don't only focus on like arms or you don't only focus on legs or whatever.
Yeah, fair enough. And then if you look at hers, that's actually a tubing exercise. I can't remember the name of it. It's something like overreach, tubing overreach. But anyway, if you look at her hips, I'm always having my clients do this because they can start to they realize, oh, I only have to spend 20 bucks on this on Amazon and I can have 50 different exercises at home. And but if you look, I'm coaching her to have really flat hips there and drive as much of that work as possible from the upper back and the top of the shoulder. In this case, you're going to get a lot of shoulder and deltoid going, but the hips are strong there, and she's getting some good work on that. You do 20 of those and you're tired, and it comes across, so you're getting a little bit of a twist in the abdomen too. It's a really nice exercise.
Yeah, this one's good. This is a good one to do at home. If you have like bands or yeah, in this case tubes, it's all very good. Like something like this, you probably want to have somebody like Art. You want to have somebody like Art around, just because the unbalanced thing could make it a little difficult. You just want to make sure your form's good. But a lot of these are exercises you could do at home.
She's moving along pretty well. You know, that's more advanced stuff she's starting to get into there.
Yep.
Cool. And then, you know, I also do the hands-on work, and this, we didn't really depict any assisted stretch here, but the hands-on work that I do is unique. It's very focused on the impact of sitting at that desk from my personal experience. You know, I've talked to Dylan a little bit about a lot of success that I have with that one big picture that's shown where I'm putting the elbow right on top of that trap and just driving that shoulder down to just make the connection to break up the muscle a little bit against the line of the way you would carry something, as opposed to just petting the bottom of the neck, right? And then you just keep driving it down. The client breathes, feels great, and it starts to make releases, which Dylan, you can speculate as to why that's the case in a moment, but I just have huge success getting people to feel comfortable and relieve a ton of that forward neck lean and strain by driving down from the top like that. And this is one of the things that I came up with as my own little, you know, technique for dealing with technique. But yeah, and then, you know, available tools, you guys can read that yourselves. But some of the comments on the bottom, I feel taller, my shoulders feel lower, my head's floating above my shoulders. That's usually after a combined lift plus some of the neck work that we're doing here, especially that trap compression that I'm doing with the elbow. And you know, I'll pause there and then I'll close, and then you can move on. Dylan, how's that sound? If you any other comment or question, throw it at me.
Sure. Does anybody have any immediate questions we could ask? Figured give a couple minutes, but yeah, I think that Art approaches this from a very comprehensive way, in that he doesn't just focus on the area that might hurt, which is something that I think a lot of healthcare people can be guilty of, in that patient comes in with, I have boo-boo here, person only focuses on this. It lacks that holistic approach that I think chiropractors are at least a little bit more known for. And I know some personal trainers, I've met a lot of them who are very like, they like to work out and they know a lot of, you know, ways to like strengthen somebody, but they may not necessarily understand the problems that afflict the human condition, I guess is a good way to put it. And I find that Art is very, very good at kind of pulling that stuff out, especially from an ergonomic standpoint, which is great. And I think that all of this stuff is very, very helpful, because he's a very good one-stop shop for a lot of the things that help people get better, especially in this situation, if that makes sense.
Thank you. And then, you know, I see, like I was saying before, all the overlap with someone like Dylan, and I'm thrilled to be working with him and planning on getting referrals to him, you know, over time. And then, you know, one other thing I just wanted to mention, there's the conversation, Dylan, about the seated desk, and then you know, the variable desk seated standing.
Yeah.
I think it's a good idea overall, because it gets the hips back into the game a little bit, right? You can take a break from sitting and stand, and there's overuse patterns on both ends of that, right?
Yep.
But you're still dealing with the tech neck and the forward head lean when you put the hands on the computer and you're gonna peer forward. So it doesn't solve the problem above the shoulders. It might begin to mitigate it beneath the shoulders. Just a lot of people ask me that. I mean, probably ask me too, like, so should I get a standing desk? I'm like, you know, you're still going to deal with some issues, but you know, it might help, and especially if you're a curious person who makes the adjustments and pays attention to what's happening. You know, it could help, but not going to be the one thing. It's not going to be the quick fix. You know,
I figured that question was coming at some point today. So yeah. All right. So yeah, that was pretty comprehensive. Anything else you want to say before we move on?
No, that was it. Thank you, and I'll just check in at the end there, and we'll go from there. Thanks, Don.
You're very welcome. So as a chiropractor, we are trained to look at certain things when they come into the office, which tech neck wasn't something that necessarily was like, hey, we're going to talk about tech neck, you know, when we're working here. But we know, you'll see that tech neck is very much I guess at least in they're like cousins of a lot of the things that people come in for with a chiro, because people usually come in with neck pain, they usually come in with back pain, a low back pain. So a lot of times that when people come in, they say, Doc, my back hurts, my neck hurts, I get a lot of headaches, I can't look behind me when I'm driving because my neck hurts so bad or whatever. But a lot of times when you come to see a chiro, they're looking more for the core of what it is that could potentially be bothering you. And I think that tech neck is something that is very, very commonly seen, at least by me for sure. Again, like we were saying, alliterating ad nauseum at this point, that, as we look in more and more on screens, what happens is that the neck starts to translate forward. So the spine is shaped in a certain way to control the effects of gravity so that we can stand upright. As we developed from whatever it is that we were before humans or when we were made, the spine has this natural S shape. Now, this S shape is designed in a very specific way to fight against gravity so that your nervous system can travel through the spine, get through your entire body, and allow you to do all the things that we are allowed to do as humans: move, run, play, all the little different things that I'm sure everybody likes to do. But when we introduce something like a tech neck, that angle starts to change. Now, the tech neck changes this angle, causes more pressure to be placed upon the skull, neck, and upper back due to the changes in these biomechanics. This causes all the muscles that lead to tension headaches to work much harder. And something I always like to illustrate for people who may not necessarily understand it is pretend that you're holding on to like a bowling ball, right? So a bowling ball, the human skull weighs about 10 to 15 pounds, depending on how much of a brain you got in that in your brain pan. So imagine if you're holding on to a bowling ball, right? This isn't a very good bowling ball, but it's the only thing I have available to me right now. If you're holding it like this, and I told you, hey, stand there and hold that for as long as you possibly can, you could probably do it for a pretty good amount of time. Eventually, you'd get tired because you're holding it, up. That's essentially what the human body's doing. So when you think of it like this is your neck and upper back, this is your skull. If you're holding it like this, you can maintain that hold for quite a long time. You could probably get through your day. And then when you go to bed at night, it, goes sideways, it relaxes, and then the muscles in that area get a chance to have a break. Now, if I were to tell you to hold on to that 10-pound bowling ball like this, how long do you think you're going to be able to hold that thing out? Maybe a minute if you've been working out with art a little more than anybody else. So if you're holding a bowling ball out like this, your arm is going to get really tired really fast. Now, that is the same basic principle behind what it is that we are doing right now. So when I say that the angle changes, what that does is as gravity's coming down on us, up, coming from above down to our feet, 12 pounds is about what you feel if you're in the perfect posture. As soon as you put that neck just a little bit forward, and we're not even talking huge distances here, this is probably like, you figure that's probably about like 45-ish. That's definitely worth it. That's probably like a 25 to 35 degree angle. As soon as you move that down to about a 45, that's probably about 20 degrees, it more than doubles. Like it gets much higher very fast. And if you're all the way out here, if you're getting into that, what I like to think of as the old lady hump type position, all of a sudden it jumps up to about 45 degrees. Or I'm sorry, not 45 degrees, 42 pounds of just pressure being slammed into your upper back. And the reason that we develop that big hump is because your body is physically changing. The nerves in the area are scared that they're going to become injured because of this weird placement of gravity on it, that it creates a fat pad in order to protect it and to keep your head attached to the rest of your body. Because if you lose your skull, you're not much of a human anymore, because that's where the brain is, right? So if you were to take like what it is to be a human, if you boiled it down to its very, 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 very base components, we are a brain that sits inside this dark cage, and its whole perception of reality is based on just the information that goes to it. And that's what as chiros we're trying to help you with. Because if we don't help you address this all of a sudden your brain's like, I don't really know what's going on out there, but man, it got really heavy really fast, and my traps are constantly screaming that they're overworked. They're not designed to carry 42 pounds every day, or for like literally 24/7 every day. I'm used to 12. So now your body's like, let me make some changes, and I'm going to tell the owner, the big guy upstairs, he's like, hey, I'm going to cause pain in this area, because pain's not our enemy. most of the time. Pain is our friend because what it does is it tells you what's wrong. Now, if you're feeling pain here in that upper shoulder area, it's telling you, hey, something's not right. We got to fix this. And this is probably what's happening is that you have a bunch of pounds of weight just being smashed into an area that's not designed to be there. And as soon as that's addressed, pain goes away because the body isn't worried about telling you what's going on anymore. So this will cause early degeneration in the neck and lead to things like arthritis and what we call the old lady hump. Arthritis is a word that I think gets thrown around a little bit, maybe a little too aggressively. Arthritis is a natural part of getting older, right? Because the body just has certain things that it has to go through in order to continue to age. But too much arthritis too quickly, that'll cause some problems. And you just got to make sure that you age the way I like to say it. You want to age like wine. You don't want to age like milk. So if you manage to maintain a more proper posture here and keep the poundage where it's supposed to be in the range of what's acceptable, you're going to last a heck of a lot longer than somebody who's using their brake pads way too much because they're slamming on it while going 50 down the highway all the time, right? So you just want to make sure that you keep the parts that you have going as best you can, as long as you can. And this is exactly why this is such a bad thing to deal with on a daily basis. And something that should be noted is that with the old lady hump, the way the fat pad is laid out is it is a very permanent thing. Once a certain thing happens with the pad itself, once the body starts to really fill it with blood, as soon as the body grows blood vessels into something, it doesn't want to make them go away. And it becomes a little bit more of a permanent thing that you got to take off with like a surgical type thing, which we would very much like to not have happen. Going under the knife is never a good thing most of the time. And it always has like some inherent risks. So if we can prevent any of those cosmetic things from happening, we very much want to do that. So this is ultimately why tech neck from a scientific standpoint is very bad and causes all the problems that it does. I hope that's informative. If you take nothing else from this, I hope that this at least opens your eyes as to why it is that tech neck is as important of a problem as we're trying to make it sound like. And obviously everybody here I think is pretty intelligent. I think you get the point of that. But it does lead into the care plan, or what as doctors like to call care plans, which is the thing that we are always trying to tell people. It's like, this isn't a one visit type problem. This is a lifestyle thing, which Art did allude to on some level. Because you figure this is probably developed over the course of a few years. It's not going to go away in one day. And that's what care plans help fix. Did you want to say something, Art? Nope. Okay. So what would a chiropractor do as far as a care plan goes? So it's important for you guys to realize, which is something that we always really, really push. I wouldn't even say push, something that we're really trying to elucidate people on, is that when they come in, when they're feeling pain in their neck, they're feeling pain in their low back, it might be a muscle causing the pain, but it's not a muscle problem. In this situation, it's a lifestyle nervous system problem. This is not a problem that occurred overnight, but something that has been brewing for months or potentially years. It took more than one day to build Rome, and a lot of the problems that we develop as humans do not take a single day. You didn't just wake up one day, which a lot of people like to think. They're like, hey, I was going really good in my 20s. I didn't have a lot of problems. And then I woke up one day, literally on my 30th birthday, and bam, I've had this pain ever since. And it's just never gone away. And now I'm doomed and my life is over and blah, blah, blah. No, that's not the case. But when we're 20, our body has a much higher threshold for when it is that things start to bother us, because of the fact that the nervous system at that point is very, very robust, and we have not had the amount of time that it takes to develop really, really bad lifestyle type syndromes, which is tech neck is. There's other syndromes and stuff that are kind of similar to these things. Obviously, that's above the scope of what we're talking about today. We might talk about that another month. But what needs to be remembered is that your nerves are doing everything they can to keep everything moving. And the goal of a chiro is to address the concerns of the nervous system, not to chase after pain, and not to like stretch muscles. I love stretching muscles because it gives people a lot of relief. But technically speaking, if you go to a chiro, the tight muscle isn't really the concern, because if we address the nervous problem, the muscle will kind of sort itself out. That's the thought. So when people come in, for the first visit. More often than not, not always the case, but a 3 times a week adjustment session thing for the week is usually what we recommend. Because what this does is allows a repeated visitation of the problematic areas, because what happens is, and I kind of giggle about this whenever people come in. They come in and they're like, Doc, you have adjusted me. Why am I not 100% better all of a sudden? I feel a little bit better, but then I go home and it comes back. Why does this keep happening? Well, the reason is because in the chiropractic sphere, if when you come into England or chiropractic, we call that like the little fish tank, and we're like having a little fun and we're splashing around, and you get perfect amounts of food and you get the little problem areas that are addressed. We've released all the things that are bothering you, and then all of a sudden you're like, okay, I'm done, bye, Dr. Dyer. And then you go out into what we call the shark tank of life. And the shark tank is scary. There's lots of different things that we just can't control. So if I could just follow you around all day, obviously not, I'm sure the law enforcement would have something to say about that, but I could potentially help, because as you go through life, you're going to be doing lots and lots of tiny little things that on a large scale, doing it once, probably not a big deal. But when you do it 24/7, now all of a sudden we have a problem. I always like to consider like a cake example. Eating cake is not a bad thing. It's not good for you necessarily. If you have cake every like once a month, do you really think that's going to cause like a huge problem if you don't have like an allergy to anything in the cake? Probably not. But then if you were to eat cake 24/7, literally every day for every meal of the day, well, then we're gonna start having some problems. You're gonna have some things that are gonna happen that you don't want. And so Technic's a very good analogous example of that, where if you're putting your neck in that position once a day, your body's like, yeah, whatever, I could deal with that. It ain't a big deal. But then you do that literally all day, every day. Now we're going to start having problems because your body's trying its best to fix that. So the care plan, the reason we do 3 times a week is because the chiropractic adjustment is insanely powerful, because what we do is we unleash all kinds of chemicals. We release things that help with pain. We are addressing range of motion problems. We are allowing the nervous system to pay attention to very specific areas of the body in order for your body to heal it on its own, which is the coolest part about chiro. Is technically speaking, when I adjust something, the body's the thing that fixes it. I just let the body do what it needs to do, because we're removing the interference of all of the junk that's happening. The reason 3 times a week is important is because it allows you to get over that hump. Now, if I were to adjust you once, what we're doing is we're essentially getting rid of any problems that might be niggling in there. And that's usually where maintenance is super, super helpful, because people just come in and we can get rid of a problem before it becomes like more of an issue for the nervous system. But when you come in with the problem of something that's been bothering you for for like 10 years, 3 times a week allows you as a nervous system to start addressing problems in a way that will permanently remove them, as opposed to getting adjusted once a week, which just kind of helps with pain, but it may not necessarily give your body enough of a reset in order to get over the problems that are bothering you. So as a good example, posture, if you were to come in and get adjusted once, you'd be like, wow, I feel really loose. You go back outside, back into a hunched over position, it's going to work its way back. Now, if you were to come in twice a week, now all of a sudden, when we adjust it, as when we adjust it, what it does is it gives your body more time to essentially force its way back. And what adjusting does is it reduces your pain levels, where you can also do a lot of this stuff on your own, where in this case, things that Art does, like with his exercises and all that, it's a very, very good way for you to get over movements that might potentially cause you a lot of distress or pain, because we're removing a lot of that weird interference that's causing your body to move in ways that it's not really finding productive, right? So that's probably a very long-winded way of explaining. There's a reason we recommend the things that we do. We're not just looking to like cause you misery by coming into the office all the time. As much as we love to see you, don't get me wrong, all the patients, I love to see you guys, but I understand that there are things that you'd rather be doing, like, I don't know, going out and playing with the kids, or like, I don't know, playing outside. Maybe not now with the concrete snow that's been going on these days, but we know that you don't want to necessarily be at the doctor all the time. But it does come to a point where you need certain things in order to get over pain, which is something that people always are kind of curious about, because they don't really necessarily understand. But this is the reason why. And there's a lot of chiropractic research, which I found this on, I think this was not WebMD. It was one of the hospitals. I forget where I found this, but um, the short-term goals, which is usually when people come in 3 times a week, is just to reduce pain and to give normal joint function back with muscle balance, which is what I was talking about before with the muscles in the front tend to be a little bit more powerful. When you come in and we stretch out the front of the chest, especially, what it does is it allows your body to move backwards so that you can strengthen it on your own, or it'll kind of happen by accident because now all of a sudden you could move in a way that you haven't been able to move in a long time. The long-term goals include restoring functional independence and tolerance to normal levels of daily activity. Every day I get people who come in who are like, I like to play pickleball. And then when I play, it hurts and I can't really play as much as I want to, which is where maintenance comes in. Because if you go and you do a movement that's not productive for pickleball, I find it's mostly hips. A lot of times the front of the hip is just moving in a way that's not productive most of the time. I go in there, I stretch it out, I put the hip back where it's supposed to be. Now all of a sudden you go to play pickleball and that movement feels much more smooth. But whatever could be causing that problem, muscle balance wise, is something that somebody like Art would really be helpful for fixing because I can't follow you to the pickleball court. If I could probably be like, right there. That's what causes it because you spin too much while you're spinning the racket or whatever when you're playing tennis or pickleball or when you swing the bat or whatever. And when I'm treating the ballet at the Boston Ballet, the ballet dancers, they are constantly contorting themselves in super weird places where I have to figure out, okay, a normal person might have a tight like Achilles tendon, but for a dancer or somebody who does a very specific movement, now all of a sudden you got so many other things that you got to consider. So in your guys' case, that's why we recommend the things that we do and why care plans are important. Because if you go back into the shark tank of life and you don't have somebody who's got your back literally and figuratively, a lot of these problems will start to kind of rear their head up. And it's always a good idea to have somebody look at you and be like, hey, here's a problem, you can get it fixed. So for most types of low back pain, a treatment recommendation of 1 to 3 visits per week of 2 to 4 weeks. It comes out that usually when you come in there, we like to measure things in 4-week periods because that's about the amount of time it takes for the nervous system to make like really big changes. And you just, the cumulative effects of being adjusted really start to make themselves apparent after about, I find usually 2 to 3 weeks is when you be like, a lot of times people are like, oh, actually, no, I feel a lot better. And at that point, then we keep working on it and, yada, yada. So when you come in to see me, this is going to be a little more of of like a quicker way of what I was just talking about. So you come in, I stare at you kind of weirdly. I'm looking at things that people don't usually look at. I look like some kind of weirdo, but I'm looking at the way your shoulders are. I'm looking at how far your head is forward. And that all tells me just little bits of information that help me make the grander picture of like, okay, maybe this guy, after we've talked, you say like, yeah, I work at a desk and, I work for, National Grid and this thing. And then all of a sudden it gives me an idea of like, I better look at his neck because I bet he works at a computer. We're joking around and asking questions and stuff and we're having a good time, but there's a lot of very important information. And a lot of times a good doc, I think in general, will just shut up and just let you talk because the most important information is the weird little comments that patients make that you don't even think matter, where you're just like, yeah, I woke up on my uncle's couch because I had to stay over because I was driving for 16 hours to go visit my uncle. And that just tells you millions of little bits of data points that help distinguish what might be a problem. And that's what a good physician pays attention to. They don't come into it with a hammer hoping that you have a nail. We come into it with a toolbox and trying to figure out, hey, what kind of data points are we looking at here? What tool am I pulling out for this type of situation? Yada, yada. And I think that's the glorious thing about chiropractic is that our toolbox is very big because we approach it from a very, very holistic type standpoint. So the treatment phases, when you first come in, I'm going to go over this real quick. When you first come in, we usually say 2 to 3 times a week because you're in pain. We want you out of pain so you can go back to doing things you like to do so that when you go into the next phase, which I call the maintain the gain phase, we are adjusting you once or twice a week in order to keep those bones and muscles and the nervous system in a place that it finds very, very happy and content so that you can continue to do the things you want to do so that you get stronger in those positions in order for you to become more independent so that you don't have to come in all the time because you're in pain, but you're coming in because you want to maintain that, which is what we call the maintenance phase, which is usually like, this is very, very patient dependent, I find. I think in a perfect world and what research has supported is that every like 2 weeks is pretty much the point where like everybody gets a lot of their issues addressed. But there are some people who are more sensitive where once a week is what they need. And there are some people who are of a much hardier stock, I guess, where they can go an entire month. Usually by the time, what I've noticed is that if they wait the whole month, they come in with a problem because they're like, hey, I waited a whole month and then yesterday I woke up with pain and all that, blah, blah, blah. Because a month I find is maybe a little bit too long because now all of a sudden their problems kind of start to reappear, which is why I think the people that come in once a week or every other week tend to be a little bit more consistently happy, I guess might be a good way to put it. So that's the benefits of chiropractic is that unlike not a personal trainer, but more like a physical therapist, you go to a physical therapist, they treat you however many times, and then they're like, okay, bye, see ya, maybe when you break your leg or whatever. When you come to a chiro, the glorious thing is that you can come and see us for as long as you would like, as long as you're getting some kind of benefit, which a lot of the benefits you're not even aware of, which is, I think, one of the coolest things. So following a care plan helps address underlying causes of symptoms. Pain is not a good gauge of improvement because pain is very subjective. My sense of pain and your sense of pain, two very different things. The only thing I like to think of as pain is that it tells you that something is not right in a certain area. Pain is not necessarily something that's good to measure because of the fact that there's so many different components to it. A lot of it has to do with how you eat, so a lot of how you do this or that. So when you come in and I'm asking how you are, you might answer, hey, my shoulder hurts. But then the other comment is like, but I was able to hang out with my dad and we went and played, we went skiing or whatever. That's a real improvement in my book, where because if somebody can't do that kind of stuff, that's a problem. That's really what I'm interested in. Not to say that I don't find your pain interesting, but it goes to show you that a lot of people are in pain and they kind of are just expecting a lot of pain, and or a lot of times people are just doing things that cause them pain. People that study or people that work at desks are a great example. They're just going to kind of always have like a weird sense of maybe not pain, but they're always like, I always feel tight. And that might be just something that people have to, I don't want to say deal with. It's something that's just a bad Shark Tank type situation where you can't escape it because that's how you make a living. So if you came in with that kind of problem, I could be like, just stop working. There you go. Problem solved. Okay, bye. I'll see you later. It's like there's a lot of things that you just can't avoid, right? So like that's life, right? And when you come in to see the chiro, what happens is that we just stop those problems from becoming bigger problems. So each treatment is a small push on the nervous system to create a more optimal system. I call it a rubber band. If you stretch, if you come in with a really stretched out rubber band, or excuse me, let me rephrase that. When you come in with a rubber band that's very, very like tight, what happens is that we adjust it and we just kind of pull it just a tiny bit. And eventually you keep pulling that thing. And after you get it to a certain point, it stays bigger longer because of the fact that now we got things where we want it. And as a good example, if you come in just once and we just stretch that rubber band, it's going to take a heck of a lot longer to get it all the way out here if you're only coming like once a week or whatever when you're coming in with lots of pain. It's just something that I find very important as an example for people to like fully visualize. So every treatment is a small push to reach a greater sum total. Single treatment might help with pain, but it will not fully address an underlying issue. Every day I got to tell people about this. They come in with pain. They're like, I only have time to come in once a week. I'm like, that's great. We're going to do everything we can with what we got, but it would be much more beneficial if you come in more often. And that's exactly why. So really, really quickly, some other things that I think are really, really helpful are cupping. Really can help address some fascial problems that can happen in the upper neck and the shoulders, especially because a lot of times if somebody like hurts themselves, their fascia kind of gets all gunked up, and cupping is really, really good for helping break up that gunk so that you can get your movement back, which causes the other areas of your body to move more freely because they're not moving in weird ways, which cause issues in other areas. Magnesium is magnificently good for helping people with tight muscles. I've talked about it on every single one of these talks ad nauseum, so I'm not going to go into it too much, but magnesium is very, very helpful. If you find that you're always tight all the time, forever, you might want to look at how much magnesium you're getting. You want about 250 to 550 milligrams a day. A daily vitamin does not have enough of it, but it's always a good idea to either get a rub on. I find I've actually been messing with the ointments and the creams a little bit more. It's actually been very helpful. As someone who works with their hands a lot, my arms get kind of tight, and I've been oiling it and ointmenting it myself. And even I'm just like, ooh, actually, that's really good. So I've actually become a big believer in those. Assisted stretching and exercises combined with massage and focused areas. That's something that art is magnificently helpful for. I love massage therapists. I think that they're fantastic for wellness. And again, they're very, very good for helping you with the Shark Tank situation of life, where if you are in a position or because you take care of kids, you're constantly bent over trying to pick up the little meatballs. Going to a massage therapist are very, very helpful for stretching those areas out and just helping you, it just feels good, right? And that's not a bad thing. And then the head hang technique, I think, did you write that one down, Mr. Art?
Yeah, I did. Let's just not worry about that for tonight. But I was going to say the magnesium is a great point. I'm on it. I'm actually going to check the milligrams just to. It has to be what you're talking, but I'm on magnesium every day, man. It's great.
I drink it every night as a tea. I have a calm
Interesting.
sleep is a blessing from the highest power I've ever felt. It helps you go to sleep. It helps with your stress levels and it allows your body to relax. It's like
It,
the greatest product on the face of the
brilliant.
earth.
What's it called again, Dylan?
It's called Calm Sleep Blend.
Okay, I'll
So
check
we
that out.
carry it in the clinic. So if anybody's curious about it, we do have it.
I'm seeing you tomorrow at 9, so I'll check it out and maybe buy
Perfect.
some
Yeah.
or whatever.
I the good news is that I can order as much of it at the clinic as I want because I'll buy it because I know it's not going to go to waste because I'll buy it. And
Nice.
I don't recommend things that I wouldn't use. So that's one of my claims to fame there.
Cool.
So for the most part, that is everything that we are going to talk about today. Art, I would love to thank you for coming on here before we end the recording. Is there anything you would like to say before we close down the recording part of the presentation?
Thank you. It was a lot of fun. I learned a lot from you just now, and I think I feel pretty good about the way this went. So thanks. It was brilliant. Yeah, and there's my contact info. Just easiest way to get me is just text me on that number or email me. You can book on my website, but I mean, I wanted to make a little offer for anybody who attended this webinar or who makes any sideways reference to it. I'll knock $29 off for a 1 hour session. So my a la carte is $129 an hour. You'll come in at 100 if you just mention Dylan, Englander Chiropractic, or this session, this webinar today. And thanks again, Dylan. It was really cool. Thank you.
Yeah, very welcome. And if you are curious and you want to see Art, I do have some of his cards in the office just in case you're like, hey, there's this guy, it's your thing. I don't remember his name, whatever. I get it as someone who has a goldfish brain at the most important times of his life. I get it. So if you need his card, I do have some of them. They are up by the front and I have some in my office. So if you're curious and you are very interested in trying them out, I do have cards for them. And just mention that you had the seminar and you will get yourself a swanky little discount. I would also love to offer a discount in that if you are not someone who I see on a regular basis, because we did pull some people today who are not actual like active patients. If you are one of those people or you know somebody who has tech neck and could really, really receive a lot of benefits from coming to a chiro, I'm going to knock $50 off of the first visit, which does include the x-rays and stuff like that people absolutely love. I love x-rays. I was never a huge fan of them just because it's a lot of work and I didn't really see the benefits for it. And then I started really using it. And I'm like, oh, okay, never mind. I was very wrong about this. I have seen some things in some x-rays where I'm like, it all makes sense now. That's just a very, very helpful tool. Even I'm growing as a person on a daily basis. And I've been doing this for like almost 7 years. So if you know somebody or you have a kid, we do have discounted rates for people who are in the military. We have quite a few openings for new patients because with the new year, lots of people have been just going around doing stuff. People visit, disappear for vacations and blah blah blah. If you know somebody who does it, we definitely do have openings, and I am looking to expand all the time. I'm looking to expand into teams. Hopefully, going to be pushing into like boxers and athletes, and hopefully going to get into some hockey teams here pretty soon. Yeah, I got yeah. As somebody just made the comment, someone's going back to the Shark Tank that we call life. So thank you very much for coming. I'm going to turn off the recording, and if anybody has any questions, I will be here to answer it. So thank you very much, Greater Internet. I know myself, I really enjoy doing these. We do them once a month. Would love for you to join, where you can ask really neat questions and stump me. If you can do that, I'll give you a high five next time I see you. Goodbye, recording.